To wind up our first session, may I invite Dr. Amila Alwis, Consultant Eye Surgeon, Child Eye, Dr. Prakash Paudel, Research and Evaluation Officer at Brand Holding Foundation and Adjunct Senior Lecturer, UNSW Australia, and Ms. Junu Shrestha, Policy and Advocacy Manager, IABP, to be part of the panel discussion, and that will be moderated by Consultant Optometrist Naresh Pradhan.
With this panel, with today, the money session will be completed. So this panel discussion, actually, whatever we have, the presentation, what we have done to now, on that base, we will be doing some, some discussion. And so especially what we want to see is, opinion on that, and see what findings and what we can in future, how to improve from this point. And say next year when we discuss on the same sort of a topics again, we may have a better result out of this. So that is the final purpose of this conference. So let's move on to this. So I think Dr. Prakash Paudel is with us. Is this, yeah? Yeah, and Junu, Shrestha, is there with us? Yeah, Junu, hi.
Hi, everyone.
And I've seen you on the screen. Thank you very much for being with us. Actually, as introduction was already given by Nishamani. So, right, so and then so I suppose we are going to this morning session you must have, and so we wanted to have a little cross discussion on this, and how what is your opinion on this. So very first, what is our idea is all about this how to eliminate avoidable blindness. So what do you think that totally comes from you itself? How do you think as a policy maker, as a advocacy person, how we can eliminate the avoidable blindness? What do you think? How can we do that? Can you hear me, Junu?
Yeah, hi, I can hear you now. The audio was a bit inaudible. Yeah, so talking about the avoidable blindness, as we all know that 90% of the total blindness or the vision loss in the world is avoidable. People are suffering from the blindness and vision impairment just because they don't have any access to the eye care services they need. So I think that we can eliminate the avoidable blindness by different ways. The first one can be prevention, just like early screening for diabetic retinopathy, vision screening in the schools, and then the awareness campaigns, injuries prevention. That is one of the way to eliminate it. But beyond that, the major important thing is the integration of eye care in the health systems and beyond the health system is the important way to eliminate the avoidable blindness. As when a patient he or she goes to receive the healthcare service, If he or she is referred to the eye care professionals in need, then his or her the eye condition can be managed properly. So what I think is integrating the eye health into other healthcare systems like the maternal health, elderly health, child health, like non-communicable diseases is one way, and similarly integrating the eye health with the major health system of the country, including this with the health financing, information systems. This all include awareing the people in the community to the making the services available, accessible to all, can eliminate the avoidable blindness.
Thank you very much. Actually, Junu is actually, in a, uh, uh, I have to follow this paper. She's in a blindness, and she recently completed her master's on public health, right?
Yeah, public health and then health policy planning and financing.
That's right. So Juru, nice to see you here, and it will be, kind of for our students also, the newcomers also. That will be great, inspiration for them. You being here because of, I talked about you a lot, right? And then, so same thing. If I ask from Prakash, Dr. Prakash, actually, he is a lecturer at University of New South Wales, and he also holds a position in Brian Holden Vision Institute. So what do you think, Dr. Prakash, how we can eliminate the avoidable blindness?
Yes. Thank you very much for this very important question. Definitely, eliminating avoidable blindness is a main priority and also a challenging problem right now in the world. But what we need to be careful about this terminology is that we are just talking about the elimination of avoidable blindness, given that the population is growing and different diseases are emerging. There are different genetic disease as well. So given those circumstances, it sounds like elimination is unachievable. What we should think is about reducing the avoidable blindness, the burden of avoidable blindness. I think if we think from that aspect, then we can have a target. Like if the current prevalence of avoidable blindness in Sri Lanka is around 17% or 1.7%, that is what you said in some of your presentation. Say there should be a target of reducing that to by half in this many years. That is what the IAPB has been doing once it has launched 2020 with certain goals, but they realized during the time phase that there are different factors associated with that. So now there is a new strategies as Vision 2030 inside, where they have been talking about effective spectacle coverage and effective cataract surgery coverage. So there is certain percentage of reduction for those avoidable blindness. So now if you literally ask me whether we can eliminate avoidable blindness, I would say no. That's my personal opinion. But yes, our targets, our aim, our policies, our infrastructure, our human resources should be targeted in that directions to eliminating avoidable blindness.
This morning also we listened to ID Subquota regarding 2030 Insight. And so we have come to know a lot about the 2030. And I suppose during the session, we will have more discussion on that. And especially now, as we have physically with me, pediatric eye surgeon, Dr. Amila Alwis is here with me, right? And he is, so he's known for child vision, and he has his own practice of child eye, which is only specialized center for the child in Sri Lanka in, private sector. So if you take about, if you take about now what we have listened, Dr. Miller, this morning, we have a SMI, School Medical Investigation System, since 1918, right? So as we gone through the data, and we saw even from the education department that we have got, right? So number of children that has been identified, that the most important thing is too difficult to identify them. And second thing is, once that is identified, and those children has not gone for the management. So they have not, now they have been sent to the hospital, right? Definitely the government hospital they will be sending. So they have not reached to the hospital. So in this scenario, now what happens now, there is no result out of it ultimately when we see. So what do you think, how can we improve this school eye examination, setup, right? So that we can have a better vision in our school children.
Yeah, so I think, like a lot of the speakers said in the morning session, I mean, if we had unlimited financial and human resources that are in our hands, we can really set up a really beautiful, perfect system. But we don't. The problem is that I think, like you said, the school eye exam, the medical system, has been in place for a long time, but it hasn't really evolved at all. So at the moment, the problem I feel is that we've got, of course, limited resources and we're not using them properly. So what I feel is that with this whole change towards even a digital thing, I don't think even a trained PHI just to check vision is not a very efficient way of doing it. I mean, you can even train the prefects or teachers in the school and then maybe have the PHIs handling the more specialized, the more difficult part of getting these children into the healthcare system to identify their problem and treat it. So I feel that allocating, like some of the speakers said, I mean, allocating the funds, the limited funds we have to the certain areas. And then also, I mean, important thing in any healthcare system is that we don't have a trained, overtrained person performing a certain duty. You want the person who is trained at the right level to perform the duty, then you'll have the right allocation of human resources as well. But I think, I mean, we've got a very good school system going on to a certain extent compared to the region. We've also got to work on including, like some of the speakers said, not only the government schools, but because now we have a lot of children attending semi-government or private schools as well, international schools. And at the same time, we've got to work on bringing the age. I mean, it's all about school age. Now, we know that if we don't pick up certain conditions in children at even a younger age, we've got to work on, we can't be happy with this grade 1 onward sort of a screening thing. I think we need to work on awareness, on bringing this screening at a young age. And also, I think awareness, I mean, I think one of the speakers really spoke well about it. Awareness, I mean, you can identify these children, but if parents aren't aware about the problems that treating these, if you don't treat their children, this could be the result if parents are not aware about this. I mean, they've got enough financial and other economical problems to worry about. Taking a day off, take this child to school doesn't seem to be very worthwhile unless they're aware of what problems this could be in the future as well.
Thank you, Dr. Amila. It's very clear, actually, Sri Lanka, what we see is we have a policy. Now, a lot of countries, they doesn't have a policy. Say Sri Lanka has a policy since 1918, in a sense, when British were ruling here, right? So then what happens? Now, what we see is policies there, and things are happening, but not in a proper order. There is no sort of a surveillance system where whether the final output is in a correct manner that is happening or not. So it is, sort of a school examination program. Now, so there is any set of a standard that, we have, Junu, on this regard for a school examination sort of a thing?
Yeah, currently we are developing the school eye health, which is one of the major agenda for 2030 Insight which will be releasing soon this year. And yeah.
Dr. Prakash, you want to add anything on this? Because of, I see some articles on yours. Do you have anything to add on this school examination sort of a thing? Because of
Yeah,
condition now you can see the, due to Corona, the myopia is emerging and you're talking a lot about the myopia and sort of a thing. So do you want to add anything on this?
yes, definitely yes. What I think about school eye health is usually, as we can see, I was quite happy and also surprised to see that the school vision initiative that was started in Sri Lanka very long ago in 1918. That was really a good start. But eventually what happens is because there was a set of criteria or procedures that was set up during that time, which needs to be relooked at, that has to be modified based on the development that's happening in eye health system, the inclusion of new eye cadres such as ophthalmic technologies or optometrists, and they have greater roles in not only being in a clinical side, but also doing health promotion, vision screening, and that sort of thing. So definitely there should be some mechanism that involves every person that fits in that criteria, that school eye health environment. Then definitely there should be a process of bringing all those components into it, so that it would be easier for us to not only intervene, but also monitor and also evaluate and look at the impact of that sort of program. So that is something has to happen, which is definitely lacking. We have programs, we are running programs, but we don't know what impact it has caused and how it is running. That there are some other associated issues as well, benefits, cost benefits issues as well. So there are so many parameters linked with such provision. So that is something it needs to be looked into. Yes, you are correct. I have been in this field doing some sort of research in school eye health, not only just for refractive error prevalence, but also about the eye health literacy, how well they know about eye health and the disease, and whether they have good awareness about the benefits of wearing spectacles. These are the things that need to be discussed, and it should be built in the package so that it becomes a standard for every country. So basically there is no difference in the developing countries. It could be 19 and 20, but yes, we are in the same page, so we should do a lot collectively.
What we think is, this presentation or this panel discussion is not all about Sri Lanka only. Actually, the people listening from Bangladesh at the moment and watching us from YouTube, or the going through the, this Zoom, or people, some of them, they are, watching us from Malaysia, from Nepal, so different countries people are looking at this, and this will be, longer period of time, so this will be discussed. So, this is not all about Sri Lanka. Actually, Sri Lanka, when I look at, what I was a little bit puzzled about is, now a lot of people think, when the country, the people are not literate enough, or people are, financially not good enough, or people are, the transportation and those things, are not good enough, or a healthcare system is not good enough, so then people's, so then the awareness level goes down, and the blindness rate goes up, and all these things. But contrary to that, Sri Lanka has about almost 93% or plus illiteracy rate, right? Sri Lanka is having a very good transportation system. You can travel from Sri Lanka's north to south, very well established, good highways, good railway transportation. You can reach to the hospital or those things within a few just few hours of time you can reach. And education system is good, healthcare system is good. People are conscious. So even though I'm little puzzled, actually I was repeatedly thinking, why Sri Lanka has this 1.7% of blind rate, right? Which is in compared to India or Nepal or these countries, this is much worse. And but in all expect, if you take about education or a financial side or traffic or whatever, the road traffic or whatever segment, Sri Lanka is far beyond. Right, so far front, as I told you, even policy and those things wise also, Sri Lanka has like this SMI policy and other policies also, these standards also quite far beyond, but still we are back. So I will come to these questions one by one. So shall we start from Dr. Amila? What do you think about this?
Yeah, so I think in Sri Lanka, like you said, the policy, the practices have been there for a long time. But at the same time, you need organized leadership to implement these policies. You can have the policy, that's just the first step. But if you don't implement it, I mean, it's as good as not having it. Like you said, we've got all the infrastructure in place. And I think maybe there is a bit of not very much awareness about maybe childhood visual issues where they need to be screened. That awareness may not be as good as it should be. I think the awareness about cataracts and the fact that, when you get older, your vision goes down and most of it's because of a cataract and a simple surgery could restore vision. That awareness is pretty good, I think. I mean, most families in a very rural area as well would know it. But then what happens is you've got to have the organization level to screen, pick the and as efficiently as possible do the surgery. So that's maybe where a bit of a bottleneck is. You've got the infrastructure, like you said, the healthcare, and things like sanitation, clean water. So we have all that in place. So as a result, I think from many years ago, infections as a result causing blindness is much less in Sri Lanka now. It's the majority of it would be maybe cataracts, childhood vision issues, glaucoma, and now things like diabetes on the rise. That's a problem as well. So I think it's we've got everything in place. Of course, funds and human resources always will be a limitation, but we need to just be a bit more organized in how we can screen, increase awareness, screen, and then bring these patients in for their management. If you can just tweak that just a little bit, I think we can bring those avoidable blindness rates down drastically.
Yeah. So I do, wish that same, because actually, I have, good experience, now people like some of my friends who came from Nepal, from India, when they, especially now say Yashwant Sauji, when he came last 2014 and 17 with us, so he was surprised. He was telling me, Naresh, if I have chosen this country first, I could have settled here. Because of, the way, the road traffic was managed, single side road, the traffic is there, other side the road, none of the vehicle process, so that discipline that we have. Actually, so discipline wise also, we are far better. So as Dr. Osila says, like sanitation, low birth, so the infant mortality rates and all this wise, Sri Lanka is far better, but still we have these figures, so which is amazing. And when we walk and ask from the public also, have you had your eye examination once in your life? So most of them, they says no. So this is what we are still puzzling on about that, and we are working out where it has gone wrong. So as Dr. Miller says, good leadership is one factor. So what do you think, Junu? The same question I have to ask to you.
Yeah, thank you, Naresh sir. I definitely agree with Dr. Amila about the policies which are in place. But I think that there are policies, but the main thing is about the policy cycle is you plan the policy, you do it, you act it, but the last thing is you have to evaluate. So without any research, we cannot say like why is the blindness rate in Sri Lanka is very high. So we have to evaluate, are the policies being implemented? Are the people actually going for the receiving the eye health services? Because you said that there are eye health services, they are accessible, they are affordable, they are within the reach of the people, but we never know until we do a research that if the people are actually taking these services. So I think it is the responsibility now of the eye care professionals that why actually is this not happening? The research should be done, and it should be then referred to the policymakers with the evidence that, okay, these are the problems and you have to act on those in the coming modifications in the policy. And the next thing is, Dr. Norris, you said that the blindness rate is increasing so high despite all the very good facilities in Sri Lanka. I have to say that the demographic shift, the elderly population are increasing all over the world. Similarly, with the children, the lifestyle changes with the COVID pandemic, all of them are trapped inside, and the myopia, which is increasing. Similarly, the non-communicable diseases are increasing. All the demographic shift and the lifestyle changes have increased the blindness rate in the world, although we have not substantial evidence saying that these are the reasons which are causing the increase in blindness. But behind the curtain, we know that these may be the probable reasons. So we have to rule out that. As I said, that we have to reach to the population and get the feedback from them that is the policy actually working for them or not.
Thank you, Junu. And actually, Sri Lanka has a free education. Now, not only school education, actually even tertiary education is free here, right? Even campus education, even university education is free, right? So if you take healthcare system, healthcare is completely free here. Even the chronic disease medications are given free, right? Even diabetic and blood pressures and those, people if people who can afford, they can go to the private hospital, but people who cannot afford, they can go to the government hospital and get it done. So it's actually, the many ways actually Sri Lanka is a good example, right? So this is what I feel. Now, when I, very first, when I saw this public library here, and I remember I used to go British Council in Kathmandu, so right. So we didn't have a kind of a national library sort of a set concept that we don't have. So I don't know now, right? So Dr. Prakash, you want to add anything on this?
Thank you again, and I echo with Junu and Dr. as well with this regard, and yes, I completely agree that if you are launching a program, if you are having a good program or doing a good program in the community, the first priority should be you should have a plan, a better plan, a clear objective, the objective that is measurable, okay? And once you set a certain goals or outcomes at the beginning, then you get the chance of knowing whether those outcomes were achieved or not during the time period of 5 years or 10 years. That is what it happens as a national eye health policy comes every 5 years kind of thing. So once you have a clear objectives, measurable objectives within the defined time frame, and you got to go to the community, you have to have something in the program itself called as evaluation. So that evaluation is a very important aspect. So if we are just not giving any priority to evaluation at the beginning stage, at the planning stage, then we lose that momentum. So when we come at the evaluation stage, then we don't have a good data sets. We don't have a basic baseline data, and then we are nowhere to compare data, where we were and where we are up to. So that is something it could have lacking. I'm not quite familiar in that context. I may have to look into the papers and the policy documents as well. That is something I would feel that we should have such program that should be measurable, could be evaluated in certain time periods, as well as what I felt just listening those presentations in the earlier session. I was quite surprised that the Ceylon Optometric Association was established in 1961. And since it's the very oldest association probably in Southeast Asia, or even, I don't know, it should not be for US and Australia, but yes, it should be, of course, for South Asia. Having that association, I can see something lacking in terms of developing the optometry and vision science skills, or developing programs that trains a suitable eye care cadres that meets the changing need of the country. We can't just stay in 1918. We have to move. We have to now in 2018, almost beyond 2018. So in a century time, the needs are different, the technologies are different, the problems are different, and there are so many people to look after the programs. So it is not just a single medical professional that can tackle everything. So we need all the helping hands, all the supporting hands. So that is where I was just kind of puzzle. I have a puzzle, or I have a confusion why it took us such a long time for optometry program to be developed in Sri Lanka. So why I'm saying this is it could be one of the reasons, like not having a better trained eye care professionals, or not giving them a leadership to build up the leadership in taking care of those community care, basic prevention and promotion kind of work in the communities. That is where we are lacking. That could be one of the reasons. That is something I would like to add on that, on top of what Junu said and what I said about the importance of research and evaluation.
Manpower. Now we had a discussion on manpower, the eye care professionals resources, what we see, a number of eye surgeons, number of ophthalmologists, and number of optometrists, and a number of other, eye care professionals. When we see the number wise, actually we are having a issue. What do you so what I see is, now if you take in say optometry, which was introduced in national level of there was a program since 1982. Actually, American Optometrists Association decided to go to 35 countries, and out of that 35 countries, Sri Lanka falls in 1979. They decide, and 1982, Dr. C. Parker, who is American optometrist, he comes to Sri Lanka and established in 1982 a college in Sri Lanka, which is known as so known as School of Ophthalmic Technology, right? So which is still exists in National Eye Hospital, Colombo. So with that, up to say nearly 35 years of time, we have produced almost 300 people from there, right? So 300 people. And so the private sector recently, now after 2007, we, so ICA Institute starts, and then, so after 2010 only the national computer standards develops, there is some sort of government recognitions, and those things comes into the scene, and then we can start recognizing things. So because of that, number of optometrists what we have is at the moment is less, approximately about 400 in number, and we have around 150 ophthalmologists in this country. So this whole total of nearly about 21 million population is looked after by this, 150 ophthalmologists and 400 plus optometrists, right? Which is looking after this whole eye care profession, other than nursing and other optician and all the labels are there, right? So this is what is the real scenario. One thing what we see, and so I would like to, ask from Dr. Amila. Now, actually, this manpower. Now, if it is say what I was thinking was, last time also I was talking to this tertiary education, vocational education commission people. So why don't we have a PPP with the government, right? So that tomorrow, if you want to make a next level of, say, next tertiary level of hospital, like National Eye Hospital Colombo, so we don't have manpower. Even we get a building, we may get instruments, but we don't have manpower to do so, right? So this is what one thing we are lacking. Out of 21 million population, we have only one super station in the country, right? So this is what I was thinking. So what do you think, Dr. Amila, about this?
Yeah, I think, Naresh, I mean, like I said in the previous discussion as well, is that, I personally feel that every level of qualification you've got, now, for example, if you've got an ophthalmologist who's trained in surgery, and then at the same time, they are also doing screening. It's a waste of the time and effort put in to train that ophthalmologist. So I mean, ideally, if you look at, let's say, in most developed countries, you'll have the ophthalmologists doing their bare minimum of what they need to do. They're mainly focused on maybe surgery and helping medically manage the more complex cases, whereas the routine screening and even the follow-up of patients with diabetic retinopathy, with glaucoma, can be done by an optometrist. So what happens is we've got, let's say, surgeons doing screening. That really is not the most efficient way a surgeon's time should be spent. If I personally feel that, I feel even optometrists should not be spent, they are trained, they've got good years of training, and they should be also in maybe more focused in maybe following up these patients, having their clinics where even glaucoma, diabetic retinopathy, other refractive errors are being followed up. And the screening should be done even at a less qualified level. So now at the moment what we have is, we have the optometrist screening, ophthalmologists practicing more medical ophthalmology, and then you have a backlog of surgeons. So I think allocating the limited resources in the right place where it's most efficient is one thing. Then of course, like you said, you can have the facilities, but then the human. So, and I don't think waiting for the government sector to sort of fill this void is going to work. We waited and it's not going to work because of obvious limitations. So I think there has to be collaboration where, just like in the private sector for anything else, in any other industry, the private sector is actually the engine that drives forward that industry. So I think you need to, like you said, have a better cooperation between the public and the government, the private sector and the public sector, and where you work together, because I think at the moment we've got enough patients. It's not a matter of not having enough patients per healthcare profession. The patients are abundant, but I think if you work together, we'll all benefit. And there's a lot we can learn, private sector from the public from the private, and then at the end of it, of course, the patient benefits.
Thank you, Dr. Amila. Now, actually, the problem in Sri Lanka, again, Dr. Prakash, now what we are facing again is, now I don't know, now other countries too have a similar kind of a condition, I suppose. Optometry is not taken as a chosen profession. So some reason they fall into, either they have work in optical shop and then they, okay, I should follow this course. Or, or their parents are doing optical, right? Or their parents are, an optometrist, and then they wanted their children to be also same. Or, very hardly we get somebody, who, from somewhere, something, they come. Otherwise, 99.99% people, they should be somewhere in relation with, eye care industry to come into the optometry profession. So how can we enhance this? How can we improve this? Actually, to tell you fact, last year, I sent 3,000 A-level leavers. And so we told them, first year we'll give them the, scholarship of 15,000 rupees per month without paying any course fees and those things. Second year, 30,000, and third year we will pay them 45,000, and and the finishing a course we will pay them 75,000 is minimum. So even though we got out of 3,002 applications came back, they joined with us, right? So telling them how valuable this profession is, right? And what could be their future on the whole list. So what do you think? How can we, improve this condition?
Yeah. Yeah, that's really a good question. Very relevant questions for most of the developing countries as well, because optometry is an emerging profession. So basically, if we look at the history, we are quite familiar that in our context in Southeast Asia, the program started somewhere in 1970s or 80s. So from there, optometry profession has been emerging in our part of the world. And so is the case in some other continent as well, in Africa or South America. This is a universal problem. Everywhere, that's really a big challenge to get a very good, talented students in an optometry profession. But it won't remain for a long, because with time and with the scope of practice that you can observe in your cities, in towns, the perceptions towards optometrists definitely change. But at the beginning stage, it is definitely a big challenge. So is the case in Nepal as well. Since Nepal started optometry program in 1997, and since then, in the initial years, there was challenge, definitely challenge to get a good number of students sitting in the entrance exams, because we do have entrance exams selected in the course, which was not very competitive. Say every one students get admitted out of 7 students sitting in exam. But whereas that ratio has changed in the recent years, now it is 1:50, 1:60, or it could be even higher, which I'm not familiar at this stage, the latest figure, but it has changed. And one additional is we know that most of our high school graduates, they are much more familiar with the terminology doctor. So when you talk about the terminology doctor, then they are more interested in the medicine field, and engineer, then they are more into the engineering field. So that doctor and engineer takes the majority of place in that when choosing that profession. So the first intention is to get into the medicine or engineering. But when there is more competitions, then there could be a leaking of those talented people in some other professions. And once you have a good and talented students in a profession, in an optometry profession, and they understand the scope of practice, because it's not only limited to doing a vision screening, doing a refraction, and examining the eyes, or diagnosing and referring kind of things. There is a whole set of things, so many subspeciality in optometry to practice. So which we know, but they don't know. And we also know that there is scope of doing research, scope of doing into the health economics, policy planning, and also getting into the statistics and doing ophthalmic epidemiology research, get into the leadership role in WHO, IAPB, or NGOs, INGOs, and different institutions. That should be the way, that pathways to go forward, which definitely those young generation, young minds, they don't know that pathways. So that pathways somehow has to be shared in a different platforms, given the scope of practice. Yes, we have to say optometrist is not equivalent as a medical profession, but yes, there is a pathways of doing a doctorate of optometry where you can be a doctor of some certain skill sets. That is somehow that message has to be passed, and same message has to be passed to the parents who are much more, very much, what you say, they are more keen to know that where they are leading, where their children are leading. So they should know that the scope of practice of optometry. Once this happens, then eventually the things will change. So in Sri Lanka, from diploma of optometry, it's been just recently, there is a Bachelor of Optometry program, and it will take few years of time. But within those few years of time, whoever are produced as an optometrist, they should be trained very well in different subspecialty. They should not just speak about doing refraction and examination. They should be doing contact lenses, low vision, binocular vision, or sports vision, so many specialties. And I would like to give more address, more importance in research as well, because when I look into what is happening in Sri Lanka, when I search the papers or some documents, I hardly find 5 or 10 papers in the international journals or in good archives. So if those presentations that earlier some of the colleagues they presented their findings, research findings, which are very preliminary, they have been just reporting a frequency, just a descriptive statistics. They have to learn slowly. They have to learn the better statistics, the advanced statistics, and build up those skills to upskill themselves so that they can become policy makers, they can become changers, innovators. So that is how we should link this. So it's a holistic approach. So it won't change within a year. So you should learn from other countries as well, from your other countries in South Asia, from the very developed countries, what's happening there. You have to keep in eyes, and you have to just share those informations to the broader audience as well. So these are the ways to tackle that problem.
Yeah, thank you, Dr. Prakash. Actually, it was a nice insight. And number of, now in relatively numbers are increasing, true. Now say we have much bigger number coming up now. That's, again, as I told you, now most of them are from the same industry. That is what is our pathetic situation is. So, Junu, you want to add anything on this?
I completely agree with Dr. Amila and Dr. Prakash. They have much elaborated a lot of things they have to tackle with the issue. Just to add on like few lines in this, the first thing is the term optometrist. As Dr. Prakash said, that people either know doctor or they don't know any health professionals. So I think we have to resound or echo this term optometrist to the general public, that your eyes are being treated by optometrist, and so that they will be aware that, okay, my health professional is an optometrist. So that way also some kind of awareness can be raised in the public about the optometrist career, and people can choose to be an optometrist and not a medical professional. I think so. And the next thing is the career options in the future. So as any country, they plan for producing optometrists or eye care professionals in their country, they must have the plan for their deployment and their upgradation in the future. Otherwise, the problem that Nepal is facing currently is the brain drain, that a lot of optometrists, they are traveling abroad seeking the higher education or for working abroad because of the problem in the planning of or the deployment or the employment in the future. So that should be in place, and that can also be an attractive point for the early comers who want to choose the optometry. And the last thing is, in addition to the recognition by the government, this optometry profession should also be recognized by the fellow health professionals. So when they know about optometry, they will refer their patient to optometry. When they know that optometrists are there for neuro-optometry, they are there for geriatric, pediatric optometry, then they will refer their cases there. So one thing is the specialization. Optometrists, they do their own thing by themselves, do their specialization, but at the same time, it should also be recognized by the fellow health professionals. Yeah, I will add only these things. Thank you.
Thank you, Junu. And then we are already at 2 o'clock in Sri Lanka, right? So I think Prakash Paudel, Dr. Prakash, what is your time there now at the moment? What's the time now?
It's 7:30.
Half
7:30.
Yeah.
7 p.m.
So I think, it's time to, wind up because of we are already back from the it's nearly about 20 minutes. We have already, back from the program. So thank you very much, Dr. Prakash. Junu, thank you very much for being with us. And Dr. Amila Alwis, thank you very much, sir, for being with us. And I think there are a few more questions left, but no time because the time has been already 2 o'clock. So we will wind up here. So thank you very much for all of you. Thank you.